Good morning. I am Dr. Shahid Shah from the Department of Pharmacy Practice, Government College University, Pakistan. First of all, I would like to say thanks to Applied Zoological Society of Pakistan for giving me the opportunity to share my research work on this platform. The topic of my research is knowledge, attitude, and practices of pharmacogenomics among senior pharmacy students, a cross-section study from Punjab, Pakistan. So pharmacogenomics is a key to the success of personalized medicines as it minimizes inter-individual fluctuations in drug response. In developed countries like the USA, pharmacogenomics training programs are carried out regularly. So we can see the significant improvement in pharmacotherapeutic outcomes. But in developed countries like Pakistan, such practices are very rare. So our objective was to assess the knowledge, attitude, and practice of senior pharmacists toward pharmacogenomics in Punjab, Pakistan, because pharmacist is considered the pillar of health care system architectures. So questionnaire-based cross-sectional study was conducted by administering the questionnaires to the senior pharmacy student from different public sector universities like Government College University, Faisalabad, University Multan, Islami University Bahawalpur, Punjab University Lahore, and so many other universities. So all the participants gave informed verbal consent rather than the written consents because there is no clinical interventions in our study. So questionnaire was developed after literature survey, and the main points of the questionnaires were demographics, educational exposure to pharmacogenomics, knowledge of pharmacogenomics, knowledge of FDA recommendations about pharmacogenomics, testing of drugs, attitude toward pharmacogenomics, and the practice of pharmacogenomics testings. So to validate our questionnaires, our survey instrument was reviewed by the investigators for content, clarity, relevance, and ease of understanding of the questions. And we also used the pilot test for the questionnaires. The sample that we included in pilot testing was not included in our final results. And the Cronbach's alpha values for knowledge, attitudes, and the practice was found 0.78, 0.69, and 0.71 respectively, that indicate the good internal consistency. So data was collected by preparing the questionnaires and distributing through hard copies to all the senior pharmacists, and the participants or the senior pharmacists were told that they could withdraw from the study if they wanted. So our survey response rate was 78%, and we excluded the duplicate response. So here are the dependent variables. For example, first one is the educational exposure to pharmacogenomics. And this was assessed using 5 questions. And the next is the student's knowledge of pharmacogenomics, that was determined using 10 questions. And each questions had to be answered like I know means 1 score, I don't know, we gave 2 scores, and I'm not sure, we gave 3 scores. So knowledge score less than 14 was considered good knowledge. And similarly, knowledge of FDA recommendations for pharmacogenomic testing of drugs was determined using 6 questions about the labeling of different drugs as evidenced by the FDA. So attitudes of students were assessed using 4 questions, and each was answered like yes, 1 score, I'm not sure, 2 score, and no means 3 scores. So attitude score of less than 6 was considered the good attitudes of the senior pharmacy students. And the last one, dependent variables, was the practice of pharmacogenomic testings that include 5 questions, and each to be answered with always, at least once in a month, at least once in a year or semester, and at least once in a program, or never. So practice score in the range of 5 to 8 was considered good practice. So independent variables that we use were the demographics that include the age, genders, and the study institutions. So here are our results, and here you can see the majority of the students or the senior pharmacists were having the age of 20 to 25 years. And here are the different universities from which we collected the data. So here, the educational exposure to pharmacogenomics, you can see that most of the students, 93.2%, studied about the inter-ethnic and inter-individual variations in drug response during their university educations. And most of the students learn about pharmacogenomics from the university lectures. And usually 3 to 5 lectures they attended from the department to describe the effect of various genetic variants on the drug response. 52.1% of the students have been able to comprehend the implications of diverse genetic variations on drug response, and 60.3% of the students clearly describe the effects of genetic variants on drug response. Here is the basic knowledge of pharmacogenomics, and from this table we concluded that the mean knowledge score that was 12.6, and as I already told you, that 12.6 range under the good considerations. So other one is the scatter plot matrix and a linear regression model. So here is the gender-wise distributions, and we found here that female had higher knowledge than males, and the good knowledge positively and significantly affected the knowledge of pharmacogenomic testing and students' attitudes. Here you can see the gauge chart that shows us the mean score of knowledge of pharmacogenomic testings, attitude, and the practice. And the main score of knowledge and attitude is good as compared to knowledge of pharmacogenomic testing and practices. So here is the knowledge about the specific validated pharmacogenomic testings. So here is the attitudes towards pharmacogenomics, and this graph shows the gender-wise and the age-wise variations of attitude and practice for knowledge, and the linear line, straight line shows the linear regressions for both male and female. So female, we found that female had 2 times more likely to have good attitudes compared to males, and the good attitude positively and significantly affected the knowledge of students. Here is the practice of pharmacogenomic testings, and we use multivariate logistic regression models. And from these tables, we concluded that female have more practices as compared to male for the pharmacogenomic testings. So our conclusion is that senior pharmacy students in Punjab, Pakistan had good knowledge and attitudes towards pharmacogenomics. However, the practice in this regard is not up to the mark. So there is a gap in practice. Students or the pharmacists that must be fulfilled to improve drug therapy and to optimize drug response. Thank you for your attention.